Dawn Claiborne, and I'm here to talk to you today about peripheral artery disease and the latest invention that has come out to intervene on peripheral artery disease cases, which came out about a month ago. 1 in every 20 Americans suffer from peripheral artery disease. That is approximately 8 million people in the United States, or 25% of the population. So if we compared it to our class, there would be about 1 in our class who's going to develop peripheral artery disease in the future. So someone may ask, what is peripheral artery disease? Peripheral artery disease is the disease of the legs, the narrowing or blockage of arteries that carry blood from the heart to the lungs. And I have a picture here which shows a normal artery, and this one shows the plaque that has built up on the artery, and you see a decreased flow in that area. So it could be that or a complete blockage where that would be totally blocked. The risk factors of peripheral artery disease are smoking, high blood pressure, high cholesterol, atherosclerosis, diabetes, or anyone over the age of 60 is more at risk for peripheral artery disease. Symptoms of peripheral artery disease, people may ask. A lot of times it gets confused with some other problems that people have going on, but you can have pain in your legs while walking, cramping or aching legs, hair loss on the legs, smooth shiny skin because the blood flow is not getting to that area, decreased or absent pulses, non-healing sores or ulcers, cold skin or toes when to the touch. We see a lot when you have absent pulses, a lot of people come in, but when you have the cold feet and toes, that's usually more of an emergent that we usually get called in for or do pretty quickly. Peripheral artery disease treatments. Right now, peripheral artery disease can be treated with medications. There's lots of different meds out there. There's cholesterol meds, there's blood thinners that help. There's also angioplasty with a balloon and stenting or bypass surgery. The problem with stenting is one of the best things you can do, and there's drug-eluting stents. The problem with stents and peripheral artery disease is that stents there are some stents, but not all stents work in certain areas. For instance, in your hip area here and behind your knee. This is the bending areas, and what happens is the stents that are in there with multiple bends can, over time, fracture that stent and could cause more problems than what you fixed in the first place. So in these cases, they have found out that these are not able to be stented. They have come out with some flex stents that are a little bit more flexible than some of the metal stents, but they're still a little leery on using those. So about a month ago, the FDA approved what we call drug-eluting balloons. Drug-eluting balloons use Paxlovid, which is a medication that it's a chemotherapy drug, and what it does is the drug-eluting stents have been using it, and what it does is it keeps the cells from regrowing back over that area, which is very common. So this drug does not do that. But we can't put drug-eluting balloons in those areas, or drug-eluting stents, excuse me, so they came up with these drug-eluting balloons. FDA approved them for use in the United States a little over a month ago now. In Europe, they've been using them for about 4 to 5 years. So a lot of the studies that we have at this moment are from the European use and not from the United States use. So I do have a short video that I want to show.
The Impact Admiral drug-coated balloon is designed to dilate a stenosed or occluded vessel and deliver a proven, safe, and effective anti-restenotic drug dose to the lesion. To begin the procedure, a guide wire is placed across the lesion. The Impact Admiral drug-coated balloon is advanced to the lesion. The length of the drug-coated balloon must extend 1 centimeter past the lesion at both the proximal and distal edges in order to fully cover the lesion. The Impact Admiral drug-coated balloon coating consists of the anti-proliferative drug paclitaxel and a hydrophilic excipient, urea. Urea facilitates the transfer of paclitaxel from the balloon surface to the vessel wall within a single inflation. The majority of the drug coating is protected from early washout, as the balloon is coated in an inflated state, shielding most of the surface area in the folds of the balloon. During inflation, the coating comes into contact with blood. The hydrophilic urea quickly dissolves into the blood, leaving paclitaxel exposed to the vessel wall. The hydrophobic and lipophilic properties of paclitaxel have a higher affinity for tissue binding, thereby decreasing washout. Within the first 60 seconds of inflation, a therapeutic dose of paclitaxel is diffused through the vessel wall into the media and adventitia. Paclitaxel binds to microtubules, inhibiting DNA replication, leading to cell apoptosis.
So that video is just showing how the balloon opens up and the medication goes into the cell walls. So what happens, that balloon is left inflated for 3 minutes. The 3-minute mark is the minimum. They want that to be able to go into the walls of the artery and absorb into there so that medication can work to keep cells from growing on the inside of those arteries back in the same area it had before. So I have a little balloon here, and what happens is it is inflated like this in the artery. So what happens is now that medicine is going into the artery walls, and once that is done, the techs or the doctor, whoever, pull the fluid back out of the balloon to decrease it back to its normal size. And then it can either be pulled out of that artery, or you can use it again to continue opening up in an area that you need to. The drug-eluting balloons can only be used one time. So if you're using it more than once, the effect of the medication is no longer on there. It's just working as a balloon to open up the area. If they decide they want to go in and put more drug in that area, then they actually have to use a new balloon because that balloon the medication has already washed off this once. So now we have to use a new balloon to get back in there. But it can be used to open up afterwards. So then that is pulled out of the artery, and the patient is left with medication on the artery wall, and it's also left with an open flow to the blood. So in conclusion, millions of people in the U.S. suffer from peripheral artery disease. These new drug-eluting balloons just means that there is now another treatment offered to those people who do not qualify for a stent. Drug-eluting balloons will help to save lives, and hopefully we see long-lasting effects of the peripheral artery disease. And hopefully our studies will start showing a decrease in the re-occlusion of those arteries. Hopefully this new drug-eluting balloon will be one to help out peripheral artery diseases patients all over the world. Thank you for listening.